Good afternoon, everyone. My name is Dr. Monal Daptardar. I am the scientific coordinator at WOAH, and I'll try to explain you in brief what went behind the scenes for developing the guidelines. So, as you're aware that we are a standard setting organization, we all are aware of it, but a lot goes in developing a standard, and we are trying to amplify the voice of the veterinary workforce and develop some strategies for the animal health to improve the animal health. And we are supporting the members through maintaining the latest science for our disease through our terrestrial code and through our terrestrial manual. The tripartite launched the roadmap for zoonotic tuberculosis in 2017 and had identified 10 priorities for addressing zoonotic TB. Out of that, we, prioritized on three most important priorities from the roadmap. It was reducing the TB prevalence in livestock. Second was developing the guidelines for controlling TB in livestock and implementing community-based interventions considering cultural and social factors. But this is not the only way WOAH contributes to the roadmap. We also have ongoing projects on developing a replacement for the international standard on WOAH and avian tuberculin. We have a mechanism of Daptardar who is a consortium of researchers and who try to prioritize what kind of research should be prioritized by the academia and by the industry. And then these guidelines are one of the contributions towards the rotated TB roadmap. How did it all begin? So after the launch, after the roadmap was launched in 2017, we focused on developing the guidelines for controlling TB in livestock. So from 2017 to 2024, we mobilized our standard setting processes, organized expert groups, and launched a consultancy to develop these guidelines for controlling TB in animals. And all this was not possible without the financial support from US CDC. So the first step was the WOAH ad hoc group, which we organized in 2020. So this ad hoc group was brainstormed and discussed what are the challenges to reduce the prevalence of TB in livestock, and especially in those areas where elimination may not be possible. And they discussed what kind of intervention will be done and at what level. Should it be at community level? Should it be at national level? Which could eventually reduce the burden of TB in livestock. And the group identified the selected TB control alternatives. They need to be, flexible, adaptable, science-based, and of course, taking into the consideration the socioeconomic and the cultural background. The second step was, of course, the US CDC over our knight in shining armor. They provided a fund in 2022, and the objective of this project was to develop to strengthen the animal health systems to enhance prevention, detection, and response to chronic disease. And the main outcome of this project was, development of a guideline and providing strategies for controlling bovine TB in livestock. So the step three was in 2023 when we organized a call for expert consultancy, and this consultancy it lasted for almost a year, and it had three distinct phases of implementation. The consultants who are going to speak next, they first did an intense literature review of all the disease control strategies for TB which are currently existing. They then sorted an expert opinion and they collected all the expert opinion. They engaged with diverse range of stakeholders from from globally, and they gather insights through surveys, key performance interviews from global experts. Then they took all this information and structured it in a guideline, and they synthesized this information they identified in the step one and step two, and they developed a guideline which had actionable recommendations. Then it was the next step. The second, we organized a WOAH ad hoc group in 2024. And this WOAH ad hoc group then again reviewed the evidence generated in the previous step by the consultants. And they provide feedback on the guidelines and they gave recommendations on what kind of dissemination strategy would be needed for these kind of guidelines. And then this was almost it, but no. We also had an in-house publication process, and they have to be given due credit. So a lot of development post uh, post making the guidelines technically sound. We had to work a lot on it on designing, copywriting, and translation in two more languages. Currently, the guidelines are launched in English. We soon will have the French and the Spanish version launched by end of this next year. And what do you think are the next steps for WOAH? So just remember, this is an evolving document. And then we have a French and a Spanish version coming soon in next beginning of next year. And then what we are planning is a major dissemination of the guidelines to make countries and members like you aware of what are the potential possibilities for you in order to reduce the burden of TB in animals. And maybe if maybe if there is interest, we can also think of piloting these approaches in some countries. It depends upon the interest. And you will come to know more about these guidelines in the next step when Francisco and Vivek will be talking about it. And that's it. Thank you for the team and the WOAH team. And we are happy that you all showed up and you listened to all the goof ups. But thank you for your time. Thank you.